Hello, welcome to the Go2Him podcast. In this episode, we talk to consultant clinical psychologist Dr. Nick Hawkes about eating disorders. We discuss the subject of eating disorders from the point of view of men. Nick teaches us about the issues surrounding these conditions and what we can look out for and where we can go for help. Please don't forget to like and subscribe, and that you can contact us at go2him.podcast@gmail.com. You can also join our Facebook group. Enjoy. Hello, Nick. Do you want to tell us what you do and who for?
Yeah, I'm a consultant clinical psychologist. I'm offering therapy, adults with eating disorders in Bedfordshire and Luton. Work for Elft NHS Trust doing that.
And you also teach at the University of Hertfordshire?
Do a bit of lecturing here.
Yeah.
At UH, a little at UCL at the moment.
Nice.
On a CBT, cognitive behaviour therapy.
Excellent.
Training course they're doing.
Oh, nice. When you do your teaching at the university here, is that on eating disorders and stuff, is it?
Yeah. Cognitive behaviour therapy, some other topics.
Yeah.
Core beliefs, panic. My main specialty is eating disorders.
Fantastic.
So that's CBT, right?
Yeah.
And that's something that I think you see a lot in mental health therapies. What is CBT? What does it mean, Nick?
Well, that's a question with short and long answers, Nick. Cognitive behaviour therapy is looking at any connections between how we're seeing things, what we're doing, how we're feeling emotionally. So there's a broad family of cognitive and behavioural psychotherapies. There tends to be different specific approaches for different specific problems. So there's a form of CBT that's for eating disorders. You can't not just any old CBT, and there's different approaches for panic or OCD, obsessive compulsive disorder, or whatever else it's been evidence-based for.
So it's not a one-size-fits-all type therapy.
No.
It's a specialist for the different disorders that someone
That's
may
right,
have.
yeah. We have an approach called Mantra, which is a Maudsley model out of the Maudsley in South London, which is one of the...
That's a hospital, isn't it?
Yeah, but it's also, an outpatient setting and an academic link to King's, and they do a lot of development of eating disorder treatment. So Mantra is Maudsley model, and we have some supportive, it's called specialist supportive clinical management, which is based on person-centred counselling and then expert advice, really. That's the clinical management, the supportive part.
Yeah.
So how long have you been into working with eating disorder therapies? Is it?
All right, so 2007 till now.
That's quite some time then.
Hasn't it? Yeah, it's about 16 years.
Wow.
Wow.
Off and on, I took a bit of time doing veteran mental health
Oh, wow.
Oh, wow.
for a while as well.
Oh, goodness.
For the NHS as well.
That's probably a whole
Another
show
episode,
there,
that
isn't
is,
it?
yeah, blimey. Yeah, well, maybe we'll get you back for that. Yeah.
Sure.
Yeah. We're really interested in your insights to eating disorders in men and young adults.
Yeah. What made you want to specialise in that area, Nick?
A lot of people work in eating disorders, they've got personal experience in their family or something. I didn't have that. I was enjoying working with anxiety and depression, PTSD, the post-traumatic stress disorder type problems. As a clinical psychologist, you've got skills at different levels. So you're not only aiming to work as a therapist. That was where you just sort of see an individual in a room and talk, and that part of the role. I worked with complex emotional needs or so-called personality disorder, with people with these long-standing patterns of emotions and behaviours, and that's quite severe end type work, very high risk and problems that go back a long way, and I enjoyed that as well in a different kind of way. And I hadn't thought of it. I saw an advert in eating disorders and I saw what you were working with, and I thought, actually, that's covering a lot of the things. So with eating disorders, some people have got more short-term problems that are not so severe, relatively speaking. I mean, I think the thing in mental health is when we say not so severe, that's not the same as if you stubbed your toe. It's still pretty... Anybody wakes up with depression, that's pretty unpleasant. But within the scope of specialist mental health services, you can see people who are functioning better than I am in their lives, but they have this problem. Then some people with more severe and complex. You know, and interest is it's got a biological part to it. The neuropsych bits of starvation goes on. It's got a lot of social parts to it, patterns in families and culture, and it's got, you know, the psychological part, the thoughts and beliefs part. So it's a very like...
It kind of aggregates a lot of what you've learned from your other experience.
It's very varied. It's the most varied specialism I've worked in the NHS.
Yeah.
For the variety, it's...
So if you took, say, like a year of work and looked back, what sort of percentage would you say of men you would see to women over maybe a year, do you reckon?
It's probably about 10 to 1.
Oh, really?
Still, at the moment.
Yeah, and why do you think that is? Is it because that classical men not sort of facing up to their issues, or is it because I think I read somewhere that it's more difficult to diagnose in men than maybe women? I don't know.
I'm not sure if it would need to be if you don't have stigma or assumptions. I was recalling working with somebody who had been given an OCD, obsessive compulsive disorder diagnosis, because there were compulsions and there were obsessions.
Yeah.
You know, this is somebody who was doing like way too much exercise, you know, sit-ups, thousands and thousands of sit-ups, and was really into the UFC, the mixed martial arts scene, and looked up a lot to the people there. And, you know, but when you sort of dug down to what all the behaviours were for, or what they were about, it was weight control and shape. You know, you wanted to look a certain way. That was what it was all driven by. So I think he was delayed to get the evidence-based help he needed by just not seeing it in that way.
Yeah, because I guess there's like a fine line between thinking that there's a fine line between that sort of obsessiveness and that work ethic and wanting to look good. And I guess it doesn't take much to sort of go over the line, I'm guessing.
And I suppose society doesn't, again, go back to that stat, society doesn't register that, okay, that there's a guy with these behaviours, he could have an eating disorder. Whereas I think probably the society recognises that, you know, it's prevalent in females. So maybe there's a switch that goes on that goes, oh, maybe she's got an eating disorder. Maybe society dictates that, and does, you know, friends may not think, okay, look, I think this. I just think, oh, you're a nut that likes the gym. You know, don't know. It's
because it is a culture, isn't it?
Yeah.
You know, that whole gym culture, and
sometimes it's more focused on, you know, muscle shape and that. If you are self-starving down to low body mass index, you bring risk. If you've been purging behaviours, bring risk. So the funny thing with exercise compulsion is that it does bring the risk, you know, for your life as a whole, but people might not notice it, or it might not come to the attention of your GP in the way that purging might. And so it's a bit like OCD in that way. Is the catch is you sort of, it's too easy to keep going and just sort of get away with it for 5-10 years before you know it. And that's the rough part of it, really.
Yeah, it must. I would guess that it's less likely. Is it less likely in that situation?
Yeah.
Is it less likely that a male would sort of refer themselves as someone else picking up, like someone, you know?
Yeah, I think both are less likely, probably. You know, there's masculine pride. Men are not very well known for going for medical attention in general, or for opening up on the counselling side. and then people don't see it as eating disorder. I know there was a piece on the news just recently, a young man from Manchester saying, you know, I never realised you could be a lad with anorexia. And then you got like other cultural things, like you're a bloke and you're an Orthodox Jew. Do you know what I mean? What are the narratives there? Or you're a Muslim person. Do you know what I mean? What's getting talked around you? Is it seen as sort of a real thing? But yeah, you're right. It's something that runs out of control. That's the defining part. It's a bit like addiction in that way. In some ways, you can say eating disorder is a bit like addiction. It's like you can tell that part where instead of controlling it, it's controlling you. It's a powerful force. When you mess with your own eating, you link in your survival mechanisms. And I always liken it like if you've got a team at work and you want to perform better, and you hire someone and they're like the best salesman, right? But they're a known character. I might be, this is probably too political, but like getting Boris Johnson, he might win you an election, but he'll take over and he'll wreck the place. And it's like that. If you've got, you sort of bring, you're sort of using weight control as a tool in your life for some reason or another, and it's quite powerful. And then it's that bit where you realise I can't not go to the gym, and you're running on an injury on your ankle, or you're exhausted, you find yourself fatigued from going up the stairs, and it sneaks up on people. Like, it's a very sneaky illness. It's like a Weasley bluffer. It's
And as you talk, Nick, one of the questions, and it's a very basic question, what is an eating disorder, right? So, for me, I've got my perception of what an eating disorder is, and it's probably very narrow-minded. I've always looked as an eating disorder as a form of self-harm or a form of control, like having control of something because maybe there isn't enough control going on in another aspect of your life. As far as my brain goes, I've not thought about it as a wider thing than that. And you've already given so much detail, and I always learn a lot from these things. But that, the first few minutes of this cast, I've just gone, woof. What a broad thing this is.
Yeah,
so
it's massive.
Taking it back to something really basic question, Nick, what is an eating disorder?
So an eating disorder is an overvaluation problem. So for all of us, different things are important. Work, family, hobbies, whatever. And for most of us, our appearance or our eating or our weight is something that matters to us to a degree, right? People aren't wandering around there feeling great about themselves, their physical appearance, do you know what I mean? And but it's a part of our mind. And if you had a pie chart, and we use this in our work, and this pie chart was of all the things that you thought about day to day, and you put a clicker, and if that pie chart, for most of us, it will have a section on it which is eating and weight. But for an eating disorder, that pie chart will be 99, 90, 100% eating, weight and shape. So what's happened is it's taken over the mindset, it's dominating the mindset. Whatever happens is filtered through that. Like if you're invited out, can I go there? What can I eat there? So the key thing with it is it's the over importance of weight and shape as a source of self-esteem or how you judge yourself.
And that, see, this kind of blows my mind, right? Because I've worked in offices majority of my life, right? I've worked with males, I've worked with females. Now, females are always on some kind of diet, right? This seems to be something that's very important to them, but also males. And there's certainly been times in my past, as you know, Alan, where I'm like, right, I'm going to do a plant-based diet for a couple of months. and see how my workouts go off the back
Yeah.
of that. Or I'm going to cut gluten out completely, and I don't get obsessed with it. But for me, it's always like, okay, I'm going to do that because the summer season's coming up, and I'm going to eat so much meat on the barbecue if I do 2 months this. So I kind of enjoy the diet chats with people in the office, again, male or female. But the modern office, even now, I'm thinking about guys that I work with in the office because, like I said, we've only just gone back, but everyone's always got their way of eating. So I expect detecting something like an eating disorder in that environment can be very difficult because it's diluted with fatty diets. I've got a pal of mine who's been reading up a lot about fasting, and he just keeps talking to me about
intermittent fasting.
And he loves it, and he tells me how great, but it's an obsession for him. He's like, right, this is what I'm doing now, and it's all he talks about. Right? But the previous time I would have gone around his house, he's obsessed with his new kind of gigantic car control thing for his PlayStation. And that's his obsession then. So there's always something new. And no, I don't think for 1 minute he's got an eating disorder. He was going on holiday, wanted to lose a bit of weight quick, and he read something that resonated.
Not everyone who goes on a diet gets an eating disorder, and this was an expert by experience as someone who'd been it. And they said not everyone who goes on a diet gets an eating disorder, but most people who get an eating disorder have gone on a diet, and that's where it kicks off, and it's a snowball effect.
Because the things that you say, the weight and the shape and the pie chart, which, excuse the pun, it's at times when I sit there and all I do is think about food. Because I love food.
But what are those times, right? That'll be...
Sat at my desk at work.
Yeah, there's 2 ways it can go. So there's the food way. Maybe you're onto a low blood sugar.
Gotcha.
Again, we're designed for that. That's what our system's meant to do. It's meant to, it's all happening, it's managing itself, and it's happy, and then it's like, be thirsty now, look for water, be lonely now, look for a person. And so that's happened. And the other part would be the fact that there's the food part and the mood part. And the mood part might be if maybe you're having a bad day, or, you're a bit PO'd with somebody. Some people, you'd be like, I just want to go F it, and you'd be like, well, I could go and I could have a drink, but I'll get sacked. I could spend some money, but I don't have any. All right, I'm gonna have a chocolate bar. Do you know what I mean? So sort of emotions
and being bored as well can affect it, can't it?
Anger and boredom and all these things. And
food
again,
cheers me up.
Again, that's normal. And it's then when it runs out of control. When you can't get joy from other things, or when you can't really attend to other things properly. In that way, I'm sure I was hearing someone talking about the alcohol, and you're right, the normal part, it's part of life, but he was saying that, talking about, let's get pissed, that does make it easy to either to not see your alcoholism or to hide it. And I think similarly with eating disorder, a lot of it is... on its own, the bits you see as normal behaviour. It's what we're all doing, aren't we? Especially on the social media. That has not helped the thing.
No.
I think
Very
I logged
unhealthy.
into Instagram, I think it was. Never used it before. Logged in once to do a sort of, what's it called? A live thing where you, again, Eating Disorders Awareness Week. The screen, like the auto... I hadn't got any algorithms. I hadn't put anything in yet. And it was just full of toxic shite. Body image shite, comparison shite, diet shite, and everyone's selling something, and that's the other thing.
It's scary,
like
isn't it?
the keto diets and the fasting. Someone's making money out of that.
Oh man!
So it's in someone's interest to get you
that
hooked in.
cure thing.
I get that all the time. A new one I've started getting recently, and look, the power of advertising, because I like that, especially conversations that we've had about coffee. I keep getting this advert saying, look, I've changed my morning coffee for this morning mushroom drink. I'm like, that sounds interesting. It's the power of the mushroom.
What like a coffee made out of mushrooms?
Psilocybin. They are going to try psilocybin for anorexia, but that's a different story.
Yeah, wasn't there like a general thing they were going to try and use it for depression in general?
Yeah.
Yeah, because
Anorexia too. Anyway, that's another story. That's a different mushroom.
Yeah.
yeah,
But you're
sounds
right,
rank.
and we discussed this. I think it's when we did our intro.
that was
discussion.
our taster episode, which is 15-minute
Yeah.
right at the beginning, which I'd really recommend because we talk literally. Most of that was talking about social media and how
exactly
how unhealthy it is,
and like you
or
said,
can be.
like you can visibly see the impact of these filters on the female population because people have started making themselves look like what the filters did.
Yeah.
You know,
there's that part.
you can
on
see it, but we were saying you don't necessarily see it so much in the male
But
population.
even like people curating their lives, you say that, but who's going to put their if you're going here's me on holiday, if they're looking at that and their belly's hanging over their waistband, are they going to post that one? It's still going to be curated.
Yeah.
And they've probably gone through this massive diet to make sure they look good on holiday.
Yeah.
And the different angles.
Yeah, different lighting and all that.
Yeah.
I mean, I know this is slightly off topic because I mean, we have a lot of lady listeners, but the things that worry me is that when you see all these programs on what I call offshoot channels, you've got ITVB, you've got one of the Channel 4 ones, I think, I can't remember, and you've got all of these other ones where where they follow these sort of like Z-list stars. There's like all these ones where these like girls who are in like Only Way is Essex or something like that, and now they're having a baby, and now there's a series, but there's all these girls that follow them as role models, when really and truly, what is there to follow? That's what I don't get it. What is there to follow? Because they're all these girls who are on these shows, and actually, from a male perspective, their partners are all sort of usually like burly, sort of, looking like they're carrying 2 rolls of carpet types.
2 rolls of carpet types. I've not heard that one.
Yeah, sort of like standing with your arms like sort of, 2 rolls of carpet underneath. I just think it's that, although it's sort of like a very overt way of showing your life, don't think they're great role models at all either, because these people have made a load of money and they've had a load of like surgery and stuff on, their bodies and whatnot. They've probably had tummy tucks, they've probably had bum lifts and all sorts of things. And there's people watching that, in their bedrooms or at home, that or whatever. And it's an unrealistic.
I hear what you're saying.
Role model. I'm not putting it very well, but
there are worse role models though.
It's more under the radar, isn't it, with men?
It is, and I think probably it's, again, going back to what I was saying earlier, men probably don't recognise. There's one thing getting a guy to accept that perhaps that's something they have, but I think they need to recognise it first. And I wouldn't know the first thing about what's an eating disorder or what's an addiction to Haribo.
But Haribo, but it wouldn't be the first thing that would go through your mind if you had a mate.
No, you're right, and that's my point earlier. I think if my eating become irregular, right?
Yeah.
I think, why am I doing this? Right. First and foremost, on a Sunday, you can guarantee my eating habits are disgusting because I've probably had a few beers the night before. I make bad choices in food.
No, don't be saying good and bad food.
Is that not?
Is that not a thing?
No, I would say not, because then you're labelling. What is that going to be? That's going to be maybe an omelette and chips and peas if it's, or a fried breakfast or something.
I think probably over the course of the day, I'll probably chuck a couple of pies in the oven. Yeah, nice. This would be after a maybe fish finger sandwich for breakfast.
Yeah.
Any bag of crisp I can get my hand on, and definitely a bag of Haribo at some point.
Okay.
And then in the evening, I won't be asked to cook because I had a big one the night before, so I'll get a takeaway.
You're probably knackered because you're hanging.
Yeah, and so I'll probably get a Chinese or a curry and sit there and eat way too much, and then feel sorry for myself about the food I ate rather than what I drank on a Saturday night.
Well, yeah. And the thing with that is that way of eating has its place on a day like that. Now, if that's happening
Fantastic.
every day,
Yeah.
right,
Yeah.
then you've got a wider issue. It's, why am I drinking every night and then, so it's about that. So it's the big picture. The reason you wouldn't say this food is good, this food is bad, is because it's all the big picture. Broccoli's awesome. Haribo's awesome. Pies are awesome. Quinoa. I like kefir.
What's kefir?
It's this yogurty, sort of Mid-Eastern yogurty drink thing. And I've seen that a lot of my patients would drink the kefir.
Yeah.
'Cause it's like protein. Really like, it's quite sour. Not really massive amount of food there, but it's got good, what is it?
Gut.
Calcium and definitely good for the gut microbiome. But the thing for the gut microbiome is you have 30 different plant-based things. It's variety. Variety is the key. So what would happen if you had that pattern and then the next day you gave too much importance to the blowout? Then you might try and fix it. You know what I'm going to do? I'm going to fix it. Going to the gym, burning it all off. Okay. And then you get in a cycle of that. And then maybe you haven't eaten enough the next day because you're trying to make up for it, but then you're hangry.
Yeah.
And then you lose control and you order a takeaway and they're like, shoot, I shouldn't have done that. And it escalates. So the thing is to be quite chill about what I would say is, I talk about energy-dense food that's tasty, palatable, and less energy-dense food. Double cream through to lettuce. It's all good stuff. We've got good advice on how to mix it up. A diet of mostly Haribo. Not so great.
Yeah. Oh, no.
Damn it.
Yeah. So we're on just to fill you in, on one of our previous episodes, we were talking to actually another Nick, a friend of mine, who has early onset Parkinson's.
Yeah.
And we were talking about how Parkinson's can give you obsessions, give you an obsessive, bit more obsessive than how you would be if you didn't have Parkinson's. And Nick was talking about how he buys a bag of Haribo in every, because Nick, you have to travel.
Yeah, I travel a lot.
Yeah,
Job,
and you buy a bag of Haribo in each country. Try to get one.
By 2 of each one. Eat
Two.
one.
Oh yeah, of course.
Yeah.
Eat one, put
Eat
one in
one.
my collection.
Yeah.
Yeah, which is cool.
Yeah.
Because it hasn't taken over your life.
No.
It's taken
But it's
over,
not an
it's
obsession,
taken
though, is it?
over a cupboard.
Yeah,
Yeah.
but it's not an obsession, though, is it?
Well, the obsession bit is
Yeah.
having 3 kids that really want to open all of those bags
Oh,
in there.
yeah.
And it's like, no, we've tried that one. But, yeah, but what are they doing sat in your cupboard? Fair. It's the having them.
Yeah, I mean, what else would you do with them, though? Because you can't... Could you display them?
Yes.
Good.
Could you?
Yes.
Yeah.
Guess you could, couldn't you?
We could use that room at the Hertford Museum.
So, as part of some of my reading that
Yeah.
I've been doing, there were a load of different kinds of eating disorder that I hadn't heard of or read about before. I was particularly interested in the ARFID, which is the Avoidant Restrictive Food Intake Disorder. That interested me because I wondered whether there was a fine line in that between sort of being a choosy eater or being someone who, what's the best way of putting it, somebody who doesn't like certain textures and certain types of food. They don't find them something they don't want to go near, and someone who psychologically is very opposed to them, for want of a better way of putting it. So how would you draw the line between one and the other? As someone who's just not, because there's some people who just don't like food.
Go back to that. What is it called? Sorry?
It's called ARFID, so Avoidant Restrictive Food Intake Disorder. And it says here that it's a condition characterised by the person avoiding certain foods or types of food, and they restrict their intake overall of the amount they eat, or both. And there's a sensitivity to taste, texture, smell, or appearance.
Alan, I could come in on this.
Yeah, no, sorry, I was just sorry. It's just
No.
I
was
found
not
that
between
one.
me and you, but
Yeah,
genuinely.
I found that one particularly interesting.
Well, it's because it's only been recognised recently
Oh, really?
as a
really?
disorder in
I
adults.
had no idea.
So in our scheme of things, it's a feeding disorder, not an eating disorder, which might sound like, what's the difference? But it's not necessarily the overvaluation thing. So all the eating disorders are overvaluation of eating, weight and shape. And that might be binge eating disorder, bulimia nervosa, anorexia nervosa, and atypical versions of those, which might be unrestrictive, but my BMI is not down that low at this point. Maybe the muscle focusing. Thing with ARFID is there's 3 kinds of things, and they impact eating, but like lots of things can impact your eating. If you're depressed, you can gain weight, or you could lose your appetite and lose weight. If you've got trauma, you can lose some. So lots of things affect your eating. Lots of psychological things.
Stress can.
Yeah, lots of things. So lots of psychological problems. You can even get something like OCD, and if your phobia is like germs around preparing food, you can struggle to eat well. So all the problems could lead. So with the eating disorder, it's the mindset that is the core of it. It's not any single behaviour that you might have. The ARFID, the difference there is that it's got 3 types. The one type is you've never been interested. Food, you just take it or leave it, which is an odd one. I find it hard to relate to that, but it's a very wild world with
you do meet people like that, though, don't you? They just don't think about eating.
Just not bothered. The second type on the ARFID is where it's kind of sometimes after a trauma, but it's a fear of eating. I'm not obsessed about my weight and shape, but I'm scared to eat. It might be you had a choking episode, or something's happening, or your fear of vomiting if you eat anything at all. So it's fear-based, it's interest-based. But the other one is where you find aversive a lot of things. You might be some of us like really plain food, and they've got like loads of taste buds, and others of us don't. But this is one where texture or taste or flavour, you just find it unpleasant, so it's aversion. And it goes along quite a bit with autistic spectrum, that one.
Oh, really?
Yeah, a little bit. So it does come out of what in childhood would be called fussy eating at a level. I don't know what they call it in childhood. Probably ARFID, I think. I don't know. I do the adults, but there wasn't an adult recognition of that problem. And a difference might be energy-dense foods might be in there. Crisps. Do you hear about the kid who gets scurvy because he can only eat chips? Now, you know those chips are hangover foods, so it's not that they're averse to calories, but in some ways unhealthy. And again, similarly, is when it's out of control. There's a range of us from fussy to not fussy. But it's when it's damaging your life or your health that it's all on a continuum.
I think we were talking about how do you recognise this eating disorder. So I suppose it's like any kind of and I don't want to say self-harm, because clearly you've educated me. This isn't just about self-harm, but how do you recognise that the way that you're eating has become a disorder rather than a lifestyle?
Well, don't get me wrong, because for some people it is self-harm is the function, and it's self-punishment of some sort, feelings of guilt or shame or grief or guilt or shame or grief or whatever. And control, sometimes it's there as something you can control if other things in your life are out of control. I think do you mean like recognise it in yourself, Nick, or in a friend around you? Or
both, really, both. Like A, yourself, and B, how do you recognise it in a friend? And if you could focus your answer on that, on the male population, right? Because is it vastly different, or do you see a certain disorder more common in males than females, or is it?
I think it's similar in kind. You might get more exercise focus in the men as a way of weight control, but there's 1,000,001 ways to try and control your weight. And so it's not just what you're doing, it's why you're doing it. I mean, I don't think vomiting has got any part in a healthy way of controlling your weight and your health. So what vomiting will do is it will knacker your electrolytes. It's not great for the heart. So, and equally laxative abuse, but some people have got prescribed laxatives, and where does that draw a line? So
I think probably with the vomiting, that's called bulimia. Right?
It's part of bulimia. You can have it can occur in anorexia as well. That's what I mean. Like eating disorders is the core thing is common, and what you do varies.
So that's something that I think is probably easy to recognise if you're spending a lot of time with someone. Or am I wrong?
In theory, but you'd be amazed how people do it. Like
secret.
if you think people like,
but in yourself, I mean, you'd know when you're purging.
I think if you're regularly
throwing up.
purging for weight control, that can't be helpful in any scheme of things, whatever your goals are.
And
I mean, the thing is, the eating disorder methods, they're not even good ways of having weight control, because mostly they break down,
and
mostly they cause damage or misery. So
is it common for someone, if you're with someone, is it common that they've gone through a time where they used vomiting, purging and vomiting as a way to control their weight, and they've got the view, right, once I get to this particular weight, I just stop. I can stop any time, like an addiction.
Yeah.
People think, right, okay, I'm drinking heavily at the moment. It's because of this, but I can stop any time. Is that similar in eating disorders?
I think it's like I'm exercising every day. I'm not at the gym every day. All right, are you? And you enjoying it? Yeah, it's great. I've nearly reached my goal weight. Oh, could you come out for a film? No, I can't. So it's that. Do you realise that you have a choice anymore? Or is it? It's like, are you driving it, or is it driving you?
Yeah,
now?
yeah.
Or it's taken over, like the impact on your, if you're lying to people, or it's just not working anymore. So that level of impact on your well-being day to day. Like if you had someone you knew and you were like thought that their choice of job or their girlfriend, you're like, this isn't really great for you. But if you come in and go, what are you doing that for? Then people dig in. But how would you persuade a mate that, okay, that maybe then this job, and like, do you sleep well? Do you get any sleep? Can you that's what you want to ask someone. If you're worried about someone, just go, are you all right with this? Is this working for you now still?
It must be hard, mustn't it, though? Like gauge it at the right amount, because, it must be really difficult.
It wouldn't ever be on my radar. Right? I will happily sit down with any of my friends and ask them if they were okay, and then ask them again, and try and dig in a little bit like that. But I don't think at any point would I consider that maybe they might have an eating disorder.
I think the only time I don't know if it's good or bad, but the only time I would try to intervene or try to say something was if I knew a friend, I'm only speaking about male friends, by the way. If I had a male friend who I knew was on a diet, or if they were, into the gym and whatnot, but they seemed to be rapidly losing weight, or they didn't look well, or as well as they had been, then I would be inclined to say something. It's difficult, isn't it, to know when?
Yeah, because if you saw a mate that led a party lifestyle and saw them suddenly lose weight, you'd be like, look, mate, I think you're overusing something. Right, and you wouldn't think anything of it.
Yeah.
Right?
Yeah.
But because maybe they're using the gym, right, you think, well, maybe they're getting fit.
But that's a good question if you ask it lightly. You're dieting. Are you overdoing it?
Yeah. But that's an interesting point, though. I think when somebody's like overdoing it with partying and going out all the time, and heaven knows, like, as men, we know people who have played in rugby teams and football teams and whatnot, and there's like they go out with all their football or rugby mates and out on the piss, and they'll probably have other groups of friends where they go out on the piss and whatnot, and then you're more likely, although it wouldn't be easy, you're more likely to sort of bring it up and say, are you sure you're, because it seems like you're
he's up, mate.
But I think you're less
have a few weekends off.
You need to have a rest. But I think you're less likely to try and, if you think that someone's got an eating disorder, or rather that their behaviours are unhealthy, and it's in this sphere that we're talking about today, I think you're less likely to ask, aren't you?
Let's change that.
Yeah, absolutely. Well, this is why we're here.
Because maybe you are. Yeah.
That's why we're
and it's good. I mean,
these
sessions are really good for us to learn, because you do reflect on yourself from these sessions as well. Al and I will talk to each other, about any kind of way that we're feeling. But even now, if I think about it, like honestly, if I started thinking that maybe I had an eating disorder, I don't think I talked to you about it.
No, and actually, to be honest with you, I don't think I would know. I don't know that I would.
I would tell you if I'm drinking too much. I would tell you if I'm partying too much.
Yeah.
But we've been there.
We
but
have.
This.
Yeah.
Not sure I would.
No, and I don't think
right,
that unless I visibly saw you looking pasty or starting to lose weight, or even if it had been pointed out to me and I hadn't noticed it, I'm not sure.
You'd assume I'm partying though.
Probably.
Yeah.
Yeah. But talking about like things that you wouldn't ordinarily notice in yourself.
Yeah.
So going back to, it was just, I think I'm speaking about my own experience here. I don't know when it was. I think it was probably the year before I got married, maybe sooner to when I got married. I had this absolutely ridiculous throat infection. I had this absolutely ridiculous throat infection where I had all these ulcers in my throat.
Nasty.
And I wasn't being sick, but I couldn't digest anything because what was happening, whatever it was coming out of the ulcers, and it was going into my stomach, and I couldn't digest it. So I literally had bad guts, like literally all the time. Went to doctors, and I was on antibiotics and all sorts for my throat. And what happened was, as a consequence of that, over the next few weeks, I lost probably, it was over 2 stone. I got really quite thin, and I got to the point where I was actually, because I still have, I guess, a phobia of being sick. I was constantly scared of being sick, even though I knew that the whole thing wasn't making me like that. It was the other end. I was then scared to eat quite a lot of the time. And sometimes, sometimes if you do eat, it's just normal that sometimes when you do eat, you might feel a little bit nauseous after you've eaten, or certain things make you feel that you eat, make you feel in a different way. And I think that I developed this quite nasty phobia after that. And so my eating was not what it is now. And I lost an absolute load of weight. And if you saw my wedding photos, I'm stick thin there.
So when you look at those, though, do you think you look good in that?
No, I really don't.
So there's 2 ways that could go. That happens to you, someone, and maybe if they were judging themselves by their body to start with, there's people who were maybe overweight. That happens, and they find they're not overweight, and they start to look in the mirror, and a little bit of them's like, "Oh, I quite like this." Maybe they get a few compliments. Maybe they feel like they're not going to be as successful in the romance department. Yeah, being a bigger bloke, and they're like, "I'm getting more. I think I'll get more interest." And in whatever way, then they take that experience, and then it's like, I'm gonna go further. I'm gonna keep going, and oftentimes you'll get a fear of that weight coming back on if you were judging yourself by your body a bit beforehand. I don't know how much you judged yourself by your body shape before that.
To be honest with you, I don't. Not looking back, I don't think it had anything. I don't think I gave my appearance any kind of thought. Yeah. The main issue was
some people go too far the other way.
Yeah. The main issue was that I was so terrified of being ill.
So that one, if you didn't turn that around, that would be more of an ARFID thing.
Yeah, I wondered.
Reading
that, I wondered whether that was because it was to do with trauma or some kind of trauma. I don't know.
It's traumatic. Yeah. I mean, in its own way, it's not. It's not held at gunpoint trauma, but if you can't eat, it's scary. Yeah. Unable to eat, and so that would be like. When we say trauma, like small t, big T, but so that could go in different ways. Can you see, like, depending on what your vulnerabilities are, and then you have a life stress, that's how it unfolds. Those interact in a certain way.
Because
other people might become obsessed with physical health and like start researching, or like another preoccupation disorder is hypochondriasis or health anxiety. Yeah. So you could end up being one who's like taking 99 different pills and supplements. Yeah. And again, your question is, this is great. You're looking after your nutrition, but is this, this is costing £200 a month from the special orders, or So it's that combination of you have a vulnerability, the wrong thing happens to you. and then it becomes a vicious circle.
Yeah.
That's my model of mental health in general.
Yeah.
I think the only time I've ever, I love food, right? And I think the only time I've ever had any kind of fear of eating was just after I had my gallbladder out. Because
I forgot about that.
I read so much, don't drink Coca-Cola because that's it. You're going to be throwing up for weeks, and wow. And I remember just as I went, a few days after the op, it was coming up to Christmas. It was halfway through, and I love. There's foods that I will eat at Christmas in abundance. Right? So cheese, for example. Satsumas, yeah. Like cheese, I would just sit down with the biggest kind of plate of cheese and many different sorts of cheese, knowing that I'm going to suffer bad. Right? So I balance that out by making sure I always got roll mops in the fridge, right? Because they're really acidic. Right? Because I don't have a gallbladder, I don't have a gallbladder that secretes bile, and the roll mops help digest it. But that's the story. But the point I was making, I went to see the doctor and I said, look, it's coming up to Christmas. What can I eat? Can't you eat? He says, just eat your normal food. Eat your fatty foods. Don't believe everything you read. If you do it now, then you're going to be in better shape to do it later. But if you don't do it now, then your body may not may not like it in the future. So just go and have your normal Christmas. So I thought I was screwed that Christmas. That's the only time I've been worried about eating anything.
Yeah, because had you not gone to the doctors, you could have developed some kind
of started on something like dry toast.
But potentially, if you were a different mindset or a certain, you could start a phobia, if you like.
And instead of eating it getting wider again, it's getting narrower and narrower.
And you're controlling that certain intake because you're scared that because your insides aren't going to take it because you've got no gallbladder. So effectively, the doctor basically, did he sort of imply then that your body just adjusts to not having a gallbladder?
He said just do what you would do normally, The only difference, I used to get stacks of, obviously, the gallbladder pain, right? And that for years I thought that was indigestion. So there were foods I didn't eat, right? Peppers, raw peppers, didn't touch them because for some reason that used to aggravate, and I just thought it was indigestion. Later on we find that it's just, it took a little bit more to kind of break them down. And because mine was blocked, I had a stone on it blocking it.
Oh man.
And, it's just minging. But that's the only time. I love my food. But,
I don't like peanuts and other nuts, but I say I'm not allergic, but I have a deep-seated hatred. And an interesting thing you'll notice if it's nuts, if someone says, is there anything you can't eat? I'll say nuts. They'll say, are you allergic? I'll say, no. They'll say, oh, so you just don't like them. I'm like, no, you haven't understood. There's not only two categories, allergic and just don't like. There's also the category deep-seated hatred.
Yeah.
I was, so there's been periods of time where I've kind of, I've not had gluten because it didn't make me feel good. Right? Further down the line, the stress. Like my stomach got aggravated by certain foods. Stress now, fine. I haven't got stress in my life. But I remember a couple of times being a bit like, because I travel a lot, like being in like a breakfast, and I'd say, can I have a gluten-free, please? And they'd always ask, are you celiac? And I was like, no, it's a lifestyle choice. And they'd be like, there'll be an extra charge for that. Like, all right, I'm celiac. No. It's a bizarre thing, charging more.
That's because of discrimination law.
Is it?
So they don't want to, they can't give you it's probably, like, the products probably cost more, right?
Yeah.
But you can't discriminate for disability.
No.
So they don't want to discriminate against celiac people. If it's just your choice, they're like, well, you want to choose an expensive thing. You can't pull the same one on the lobster and the champagne, right?
No.
So I can only eat lobster and champagne.
Yeah.
I want it for the same price. They're like, not so much.
Well, I don't understand why they would ask.
Because they wanted to charge him.
Because they wanted to charge me. I requested it.
That's a bit. I mean, I understand.
Yeah.
But
Oh, you want to?
If it was me owning the business, and I mean, I'm not a businessman, but if it was me owning the business, I wouldn't be asking. I wouldn't be charging.
You wanna see some calves when you're with someone and they go, yeah, I'll have a number 6 breakfast which comes with bacon, black pudding, sausages. But I can have vegetarian sausages instead of normal sausages.
Yeah. See, I find this quite a lot because I've got an intolerance to eggs. They make me quite rough. And so, luckily, now, it's superb because it has been awful, but luckily it's really good now because of the onset of more people being vegan.
All the vegan things. Yeah.
Like, if ever I'm not sure if I'm going to I'm going to get something nice to eat if it's vegan. I just know. And then they'll say, for instance, sometimes in the past when we've gone out somewhere, and even for things like pizzas, like with the, like when you get like the ground beef and stuff like that, you still have to ask. And for burgers not so much now because a lot of the time burgers are literally just meat and salt and pepper. But in the past they've used sort of egg to bind them and stuff. So when you go somewhere, and I mean, it's still a bit of a problem because I can't have brioche buns because they're glazed in egg, I believe. But when you used to go somewhere and used to say, well, can you just let me know if this has got egg in it? The look on people's eyes, you would just feel.
My mum is intolerant to garlic, right? Oh. And probably within about half an hour. But after half an hour of her eating it, she's violently sick.
She's
a
vampire.
Yeah. She listens, so no comment.
But we can't be 100% sure she's not.
But yeah, there's been times when we've gone into restaurants, Mum's ordered her food up, no garlic, and it comes out with garlic on, right? And we used to say, just tell her you're allergic to it, because then nothing will go near it. And do you know what? One of the most accommodating types of restaurants have been Indian restaurants.
Oh, really?
Yeah, absolutely, yeah.
Because that poor things, they're used to going, I want to have that curry, but make it 2 inches hotter and minus this. And they're like, you be the chef then.
Yeah.
Well, Mum just says, right, what hasn't got garlic in there? Like, we can do that, and that without garlic. Because they cook a lot of their their sizzlers and things completely fresh. So they just don't chuck it on. The sauces and things like that, she can't have those. But yeah, steakhouses, the amount of times I've seen her pick up a steak. No.
Yeah, she'll know because she'll be extra sensitive to the smell, won't she?
Yeah.
So, Nick, the only other one that I was interested in speaking to you, well, obviously I'd love to speak to you, but we're short on time, was the orthorexia.
Yeah.
I wonder if you want to just, because having read about it, I think it lends itself to what we were talking about earlier with the exercising and whatnot.
Well, like health. And, because these cultural things, they vary from time to time.
So what is orthorexia?
So, it's a form of eating. So it's not a separate diagnosis. If it went too far, it would be a type of eating disorder, but it's based around clean eating, so to say. So it's not... It's kind of trying to sneak in via the wellness sort of...
banner.
Culture banner. And, again... The problem is it's run out of control, so it would be like, things that are, you have your paleo this or, avoiding any processed food. And again, pasties have their place, So it's when the focus is on the healthiness, you might look at additives or, just different of the obsession with pure, clean eating is the big... source of a lot of this, because the eating disorder is taking advantage of our innate sense, and when we label a food as dirty, it feels contaminated and we get a disgust response. So you can see my face making a disgust face. And so when you associate foods as good or bad, clean or not clean, you're using your disgust mechanism to not eat them. I mean, if you pair something with disgust, it becomes problematic. It's very hard, and it kind of gets mixed up, the moral disgust of it being a bad food. Moral disgust, we make the same face, don't we, if we hear about a bad crime or something. So, and the one story I always tell to show this, how easy it is to associate something with disgust and how hard it is to turn around, is I got really, really sick once from malaria. And I know it was malaria because they found some parasites on a slide, guess what? But I'd been eating, the night I got sick, I'd been eating avocados. And I loved avocados. But my body associated the disgust with avocados, and I couldn't eat them for 18 months. I couldn't abide them. And that's what you're doing when you get into clean eating. You take a category of food, like processed food, or whatever the thing may be. It could be like, there's veganism, ethical veganism, grand, knock yourself out. I don't know how brilliant it is, but every has its pros and cons. But it's when it's gone, like to extremes, and it's really life-limiting, or you can't eat a healthy diet on that anymore. It's the same with other eating disorders as well, the good and bad foods clean. It's the obsession comes from trying to categorise foods into these are good, these are bad, and you're using that to condition to change your own behaviour. But then after a time you feel like that disgust that you've attributed to those foods is taken over and you can't have them anymore.
Do you think over the years, Nick, that because the choice of food now is
it's ridiculous.
You can have anything, right? The choice of food.
At any time at all.
Our parents' generation, they didn't have so much choice, right? And the generation above them, it was what you got from the butchers, greengrocers.
Yeah. What you grew yourself.
Right?
Yeah.
Back to the mushrooms.
Back to the mushrooms. Yeah. And do you think with this big amount of choice that we've got, do you think that there are more eating disorders as a result of the choice of what's out there?
No, there almost certainly are. There's been eating disorder since ancient times. So you'll find ancient Greece, you'll find ascetic people. There's I think it's Saint Catherine of Siena, survived on no food. So there's been forms, I think, of eating disorder through history. But definitely it's one of the most cultural disorders historically. And we weren't it's the combination, it's the worst of both worlds, because we, evolutionary wise, if you're evolutionary, we weren't built for wheat, let alone drive through McDonald's and 24-hour Tesco's. We were designed for survival in a harsh place. So if you're that person who's been on a diet and then you lose control, that's a part of your primitive you has been, your crops have failed and the wildebeest haven't come and you're starving, and you trek across the desert and you see a fruit tree with fruit on it, you're going to be programmed to maximise, get that energy in whilst it's there. And even with poverty and that, if you look at the old videos, I saw this one of the workers in the mill and they're eating like treacle sandwiches, and we'd be like, oh no, but that they needed the energy for the work they were doing. And so we weren't built physically for the environment post-war, but then at the same time as making it almost impossible for humans on average to maintain low weights because we're designed to lay down stores of energy for a drought. But at the same time, we've got the body image thing, labelling you as a bad person if you overeat. Fat people are lazy, all this weight stigma. So the westernisation and the it's a side effect of modern society, eating disorder is, because they're like, part of your system is saying for survival eat, and a part of your system is for survival in your tribe to be liked by people don't eat, and we're just conflicted all of the time. And the culture, the environment is trying to put us into an unwinnable game, so I say don't play the game.
I could talk about this all day. I find it's fascinating, all of this. So just to finish, say for instance, if anyone who was listening to this felt that they maybe do have an eating disorder, What do you think their best course of action would be? I know it's like a
Yeah.
generalisation way to put it.
And you're absolutely right. You pitch up at your GP
Mm.
because the sooner you get help, the better.
Mm.
You know, it's early intervention, if you can, is so helpful.
Mm.
So it's going via your GP.
Mm.
What if you think you've got a friend that's suffering
Yeah.
from an eating disorder? What's the best approach towards that
I
friend?
just think, don't go in with an agenda as such, but just be curious, show you're interested, show you'd want to know.
Mm.
So, I think, I've noticed you've lost a lot of weight. Like, let's say it was you and you'd lost a lot of weight. In my head, I'm thinking, Alan could be anorexic now. But I'm thinking, you know what, he also might have cancer and he's just not told me, right? So I don't know.
Yeah.
So I'm like, Alan, you're losing a lot of weight, mate. Are you all right? Is anything going on here?
Mm. Mm.
And they're like, I'm pleased with it. I've lost weight. I feel so good now. I'm like, okay, but, is there a point where it's enough? You might ask, is it something you could you not go to the gym out if you had to? If you got an injury, would you be able to stop?
Mm.
So just asking the normal question, same as you might do around, you're partying a lot.
Yeah.
You're hitting it quite hard. How are things?
Yeah.
How's this going for you? Are you worried about this at all? No, I'm not worried, because people might be a bit defensive. Like, you don't need to fight them. And you'd be like, okay, all right, well,
And I guess
how would you know if it had gone out of control?
And I guess you could steer the conversation in to try and get them to, put them in your shoes. Like if they saw someone had a good mate, and to try and convince them that you only come from a place of love and caring, and that you just you just want to make sure that the person who means a lot to you is okay.
Yeah, and if you're having trouble doing it, I do say that the charity called Beat Eating Disorders, they've got some guidance on there how to talk to a friend. They've even got guidance there because the awareness in GP land isn't always perfect. In fairness to them, they've got a lot of things to know about.
Absolutely.
But you can find people who are told, no, you haven't got your eating disorder, you're not thin enough, or you should be happy with this, and actually helping people to persevere, because the part of the illness that's addiction is going, this is great, I can carry on. But they've got even some advice on ways to speak to the GP if you feel that you're not being heard. So that's quite helpful.
That's superb, and we can put a link to that on the website.
Yeah.
Absolutely.
Yeah, I think that's really handy to know, actually.
Yeah, very good.
Really, really good. Well, thank you so much. A huge thanks goes to Dr. Nick Hawks for joining us. Please don't forget to like and subscribe at your usual podcast place, as well as subscribing to updates from us at www.go2him.co.uk. See you on the next episode, which is the final of this series. Thanks.